Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm here with Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we're announcing 9 additional deaths due to COVID-19. A female in his 40s from the Winnipeg region, a female in her 50s from Southern Health Santé Sud, a male in his 60s from the Winnipeg Health region, a female in her 70s from the Winnipeg Health region linked to St. Norbert Personal Care Home, a female in her 80s from Winnipeg region, a male in his 80s from Southern Health Santé Sud, a male in his 80s from Southern Health Santé Sud linked to the outbreak at Buhler Active Living Centre, a female in her 90s from Southern Health Santé Sud and linked to the outbreak at Rest Haven Nursing Home, a female in her 90s from Winnipeg region linked to an outbreak in Saul and Clarabelle Simpkins Centre in the Winnipeg Health region. I want to extend my condolences to their family, friends, and loved ones. Again, these are Manitobans, mothers, fathers, sons, daughters, sisters, and brothers. And we report them on our dashboard as numbers, but I think we all realize they're much more than simply numbers. Our current 5-day COVID-19 test positivity rate is 14% provincially and 14% in Winnipeg. We have 349 new cases of the virus identified as of 9:30 a.m., bringing our total number of cases to 14,907. The number of deaths due to COVID-19 is at 256 due to a data entry error. One death that had been reported earlier has been removed. This was a male in his 20s from the Winnipeg region, and so I can confirm that that was a data entry error. This individual is a case and is currently in isolation. And so these are dealing with a lot of data entry, and the error was made in this case, and our processes were able to pick up that mistake and correct that today. Certainly apologize for any confusion that had caused. We have a lot of safeguards on the data and reviewing of that data, so I remain confident in the numbers that we receive, and we have a process to review and correct when needed. We keep our same messaging today is to stay home. We need to bring down these case numbers. We need to reduce the amount of strain on our healthcare system, and need to take that action right now, and that's really to stay home as much as possible. The overall intent of the orders are to decrease the amount of contacts we have. So we should really be decreasing the amount of contacts we have outside of our household, and that means staying home for the most part, going out for essential purposes, the least amount of people leaving your home for those essential purposes. That's going to reduce those amount of contacts we see and bring down these numbers, which we desperately need. Along the same lines, it was a bit disappointing to hear about people driving, outside of the province to do non-essential shopping. We've heard reports of driving to Yorkton or to Kenora to do some shopping. So again, it's our messaging has been really clear, and the reasoning behind our messaging is really clear. The purpose beyond all these orders is to save Manitobans' lives. And so the purpose of the orders are that. So going around those orders puts Manitobans at risk. And so right now, non-essential travel is, we're advising strongly against it. We're advising people to stay home. We have limits on essential items for purpose, because obviously we need to ensure Manitobans have access to essential items, but we don't want in-person non-essential shopping. There's options online or curb front pickup. But right now we need to stay home as much as possible, which means not going out for non-essential reasons, not traveling for non-essential reasons. So, it's really important to get this message. We have 303 people in hospital right now, 50 of which are in intensive care. We're asking people not to travel unnecessarily. And that's the purpose of to save lives. So really trying to keep that message out there. This is going to be hopefully a short period of these level of restrictions, but we have to take them seriously. Otherwise, we're putting Manitobans' lives at risk. We all have that part to play. Avoiding gathering, staying only in contact with household members whenever possible. So that includes any gathering places at faith-based organizations. It includes at work as well, right? We're asking employers, if possible, if you can reasonably do so, have people who can work from home do so. If that's not possible, then take every step possible to reduce the risk of transmission in your employment setting. Decrease crowding, wear masks, hand hygiene, ensure people are screening every day for symptoms. Employers should also be looking at ways to assist their employees who need to stay home when they're sick, or a person they care for is homesick, or when those individuals are required to self-isolate. We continue to hear report of cases and contacts telling public health that they've been told they need to come to work or their job is at risk. So I certainly don't understand why an employer wants somebody who's infectious for COVID and a workplace, or somebody who's high risk of becoming infectious, such as a contact. So you need to work with your employees to find ways to allow people to self-isolate when they've been directed to. We again are hearing reports from public health contact tracers, public health nurses, of very angry people on the other end of the telephone line when they're advising them that they're contacts or cases and need to self-isolate. They're more angry when we delve into what self-isolation means. And remember the purpose of this. It's one of the biggest tools we have for limiting the spread of COVID, and it's the most important tool we have outside of the public health restrictions. So if we want to be able to get these restrictions lifted, we have to have very active case finding and isolation and contact finding and isolation. Without that, it's going to be very difficult to lift the restrictions. So when someone is isolating, if you're a contact of a case and isolating, the whole purpose is that should you become a case, which a certain proportion do, you're going to have zero contacts. There's not anyone you could have passed it to. So that's just stops the transmission right there in its tracks. So that means that for most people, you should be self-isolating from even members of your household. Now we know that there's a certain proportion of people in the province that's just not possible, and there's options there to try to minimize things, but that the point is that the vast majority of us are able to self-isolate effectively, and so those of us who are able to self-isolate effectively need to do so. It's the best way to stop the transmission of this virus. So please, public health nurses are they're doing their job. They're just like other healthcare providers. They are there for Manitobans, often working well within the night, trying to get this message out to people. And so please be respectful, and please understand the importance. If you're a contact or a case, the importance of self-isolating is the importance of not transmitting this to other people. So please listen to public health advice. Please be respectful to contact tracers when they reach you. We definitely are in this together. We've had our restrictions in place, for some time now. We're still seeing our numbers at a level that we can't continue to sustain. We need to bring these numbers down. However, we can talk a little bit about the projections that we had. And so projections from a few weeks ago when we initiated or decided to initiate the further restrictions, our projections were calling for up to 800 cases per day by November 22nd. So even though our levels of restrictions haven't brought down the numbers to where we feel we could sustain, it's very likely that we're seeing some benefit from these restrictions. But we can't let up. We still have to get these numbers down. So we haven't seen the climb that we expected, largely based on the restrictions and Manitobans' adherence to a lot of the advice that we have. But we certainly need to get those numbers down quite quickly. And why? And it's because our healthcare system is being pushed to capacity. Our healthcare providers on those front lines are overwhelmed. These number of cases, a number of deaths we report can't become the norm. And so again, the message is quite clear. It's to stay home and leave only for essential reasons. It's the best way that we can quickly reduce the amount of contacts we have and thus bring down the number of cases. So thanks again, and I'll pass it to Lanette.
Thank you very much. Good afternoon, everyone. So as Dr. Roussin has said, the number of hospitalizations due to COVID continues to increase at an unsustainable rate. As our case numbers rise day by day across the health system, staff and physicians are bracing themselves for the surge that is about to come and the surge that we are experiencing now. Each week, we report on the beds that we have opened that are now filled with COVID patients. We report on the number of surgical procedures canceled. We report on the number of staff who are sick or the amount of staff that are sick or tested positive and are isolating. And we also report on the deaths. So this is a virus that affects people of all ages, not just the elderly. And over the past weeks and months, we have lost far too many Manitobans. And as our case numbers increase, we are continuing to see COVID patients of all ages. On November 5th, 153 people were hospitalized with COVID at facilities across the province. 20 days later, we have doubled that number of hospitalizations, while more than tripling the number of COVID patients in our intensive care units. There are currently 303 individuals who are hospitalized with COVID-19, including 50 patients who are in critical care. Of the 79 patients who are ventilated this morning, 42 of them have COVID. As of midnight, our ICUs were operating at 146% above our normal capacity, pre-COVID capacity, with 105 patients now receiving critical care services. More moves are being made at Health Sciences Centre today, so our ICUs will have more space to add capacity for critical care COVID patients. HSC Emergency Department also opened up a 8-bed observation unit last night for patients who are awaiting COVID test results prior to admitting them to the inpatient units. So given the high number of new cases we continue to see on a daily basis, we are also preparing for moves like this in the days and weeks ahead to handle the expected surge of COVID-19 patients. These daily case numbers continue to put stress on our healthcare workers and strain on our healthcare system as a whole. We will continue to implement our plans that we have created. We have to adapt them as we go. We are in uncharted territory now, and our goal is to stay one step ahead of this virus and ensure that patient care is not compromised, as well as make sure that we take into consideration our healthcare workers and the disruption that this is causing for them. All of us need to work together to get these COVID numbers down. It's not just for COVID patients, it's for all patients who require services within the healthcare system. I want to report on the isolation accommodation centers. A new site will be opening up at the end of the week in Winnipeg, primarily to serve the shelter population. This will be a 140-bed facility to support families or to support individuals who don't have a safe place to isolate. Over the past few weeks, as I've reported previously, our 39-bed shelter unit has been functioning almost at full capacity. We opened a second facility for 22 spaces, and that was expanded to 40 in recent days, and that's also nearing capacity. So it's a much welcome space that we require. As well, our local hotel isolation site, as well as the Red Cross isolation site, all continue to work together to ensure that we can accommodate patients within the existing capacity. The hotel site had 36 rooms in use as of yesterday, and the Red Cross site was using 23 rooms. So both have capacity, so it's just a matter of balancing and streaming the patients, the COVID people who've been tested positive or close contacts to the right direction. I will also say there are 14 isolation sites now throughout the province, with 9 smaller sites situated throughout the Northern Regional Health Authority in order for residents to be able to isolate closer to home. And there are plans underway to open up isolation sites in Brandon in the coming weeks. So we'll report on that as we hear more. I also just want to give an update on the acute care situation. So the team-based models of care that we've spoken about is now being implemented at the Grace Hospital, at Health Science Centre, and at the Brandon Regional Health Centre, as well, mostly focused in the intensive care unit, but St. Boniface as well will be starting that work at their site in the coming days. And it's really important for the staff who are being transferred or redeployed to these areas. They may also be redeployed to personal care homes where there's also high demand for and need for support. We do appreciate that this is very disruptive and this is not ideal. And we understand that no one wants to be pulled from their usual routine and their trusted teammates and their familiar surroundings. This is temporary, and we are going to do everything we can to support our staff in making these transitions. Some of the things that we are focusing on is making sure we do a skills assessment, familiarizing them with a new site or the new team that they may be working with, trying to make it so that individuals can go with a partner from wherever they're being redeployed, so they have a built-in support system. But I will say that as we go through this, there are going to be times where there's opportunities for improvement. And I just want to reinforce for the physicians and all the staff that if there are things that we can do better, we're listening, and we want to learn with you, from you, to make this better. It's not where we want to be, but it's where we are. It's the reality we have to face. But we do want to do it together with you and make it as good as we can in this bad situation. I do just want to end with an email that we received from a nurse who was redeployed to Health Science Centre Medical Intensive Care Unit, just as a reassuring message for all. She was nervous about going there, and when she got there, she felt well supported, and staff were very appreciative of her help. So I'll just read an excerpt of her letter. While personal circumstances vary for each of us, and not all of us will be able to go, we can all support our colleagues who either volunteer or who are redeployed. I look at this as being able to participate in a model of care that allows the ICU to provide their patients with the care and dignity they deserve while supporting our colleagues who need our help. We do make a huge difference. And so I want to wholeheartedly agree with that nurse and thank her for writing those words and for her professionalism in this situation and words of encouragement. Staff are very tired. They're emotionally tired, they're physically tired, and they're scared of what these continual high numbers are going to bring in the future. They're going above and beyond to meet the needs of Manitobans, and they are dedicating themselves to take care of the patients, and whether they're in acute care or the personal care homes, basically the Manitobans who need them. They're there for you, and we really need to be there for them. So I just want to say that they do appreciate kind words and accolades and gifts, but the biggest gift you can give to our healthcare workers right now is to stay at home, limit your contacts, wear a mask, wash your hands, and help us to try and get these numbers down. So with that, I will open the line to questions.
Thank you. A reminder to our reporters on the line this afternoon, you will have one preliminary and one follow-up question. Up first, from City News, Mike.
Hi, Dr. Roussin and CNO Siragusa. Question for you. The Ford government in Ontario has rolled out rapid COVID-19 testing in long-term care homes. Does Manitoba have a rapid testing plan for long-term care homes, and what is it and why?
Yeah, we are currently working on such a plan. Rapid test availability is just emerging now, and so we are working on a plan that would involve testing in long-term care facilities. So we don't have a finalized plan, but there'll be more to come on that.
And my follow-up question here, I've seen myself, and we've had a couple people saying that when they're grocery shopping or doing things in public, they see some people still kind of pull their mask down to answer the phone or cough into their mask without covering their mouth with their elbow. Can you just stress the importance of not only wearing your mask, but wearing it properly and trying to follow some semblance of a rule with the mask?
Yeah, for sure. And, this is the part of our messaging with the masks. We encourage mask use indoor public places. And it's just in addition to all the other fundamentals, the physical distancing, the stay home when you're sick, the hand hygiene. But then, like you say, wearing that mask, we must use it properly. So it needs to cover your nose and mouth without any gaping. We should avoid touching the mask frequently. Every time we do, we should sanitize our hands. And again, pulling the mask down, having it dangling on an ear or under your chin or your nose exposed from it entirely defeats the purpose of wearing a mask. So do practice all the fundamentals, including wearing the mask. But when you wear that mask, do whatever you can to wear it properly and consistently.
From CHVN, Taylor.
Hi, good afternoon. People right now are trying to stay active and healthy, and they're looking to do these kinds of things outside. But how can we safely do popular activities like tobogganing or soon skating when there are going to be a lot of people in the same areas?
Yeah, and so we're going to have to, the public health orders right now for outside group sizes are 5, so that's what the limits are right now. So you need to find ways to stay active. It's very important to stay active, both when you're at home, finding ways to stay active, and then also when you're out and about outside enjoying some of the winter. But you'll just have to plan ahead and make sure we're not getting into crowded places, and just keep those group sizes down.
And spending a long period of time with only people in your household can create cabin fever. How can we combat this and be nice to the people we live with?
Well, I mean, I think overall, this is a very challenging, 8 or 9 months for many people. And so when we talk about being kind, that is a strategy in our pandemic. And so that includes people in your household. Includes people outside your household. We want to ensure we're connected still with people outside our household, trying doing that virtually. People who are vulnerable, there are certain exemptions in the orders to ensure that occurs. But like we talked about, staying active, trying still to get outdoors and enjoying some of these the winter months. And then being kind to our healthcare providers and including public health. We're just hearing more and more negativity towards, especially public health professionals. It's certainly understandable why someone would find it quite a burden to have to self-isolate for 14 days. That's no doubt. But it should be quite clear on what the benefit of that is and what we're trying to accomplish by that. And it should be also quite clear that it's certainly not the public health nurse's fault who's calling you. So I really encourage everyone to be kind, find ways to stay active, find ways to stay active during these tough times. But we truly are in this together. So we have to try to find ways to get through this.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. My first question is related to personal care homes. So with home care providers in Winnipeg now being deployed to personal care homes with outbreaks, what additional measures beyond, the daily symptom screening are being put in place to ensure that the virus isn't introduced into people's homes, people who are living in the community? Mm-hmm.
So for home care, we have guidelines in place where there is a point of care risk assessment that is done by the healthcare worker prior to going into the home. As well, depending on what that risk assessment demonstrates, it may say there's minimal risk. So healthcare workers can still go in the home. They should wear their PPE. If there is a risk of COVID, then our guidelines indicate that the worker should determine if it is an essential visit that must occur, because maybe it can be done virtually or maybe it could be deferred later. If it is something that must proceed, then the appropriate PPE should be in place and all the precautions, as much distance as possible, as well as really good hand washing.
Thanks. So I guess what I'm hearing with that is that the healthcare worker doing a risk assessment of the client in their home, but I'm kind of wondering about the other direction, right? So the home care worker who's working in the home with an outbreak coming into a person's home in the community. So how risky is that practice, given what we know about how the virus spreads in personal care homes and pre-symptomatic transmission, having home care workers potentially carrying that virus out of the outbreak situation?
Yeah, with the hand washing and the PPE, that there should be protection. There's always a risk of a breach in the PPE, but if it's worn correctly and it's worn consistently, then the risk of catching COVID is minimized for sure. You're right, there is that asymptomatic spread that's possible, like the pre-symptomatic, So that is something to watch. But I think the PCHs are doing a fairly good job of cohorting their patients and really watching the screening. So there are preventative measures in place, and the region is working closely with them to mitigate the spread wherever it's possible.
From Global, Brittany.
Good afternoon, Brittany from Global. My first question is for Lanette Siragusa. Lanette, a couple weeks ago you said if there was a worst-case scenario, this would be it. We're hearing, these escalating numbers, 146% above what is normal capacity, hundreds and hundreds of cases reported every single day. At what point are we hitting that breaking point? Where are we now if last week was the worst-case scenario?
Well, I guess, like Dr. Roussin said, it could be worse. With the restrictions, the numbers are still very high, higher than we'd like, but they haven't really increased. So that could be worse, I suppose. Right now, we still are in the process of redeploying staff and minimizing other services in order to increase the demands in critical care and medicine and the PCHs. So I can't tell you when we're going to hit the end. We're going to keep trying. We're going to keep looking we have the space, we have the equipment, we have the supplies, and we have the staff, but it's just a matter of what can we give up in order to move over to this demand. So there's no magic number, and there's no time that I can tell you. We're going to keep going, and we're going to do our best to meet this demand, and really, it's the work of the teams who are providing the patient care is extraordinary, and the leadership is exceptional, and so we're just going to continue down this road.
Thank you. My next question is for Dr. Roussin. People are starting to think about the holidays right now. Obviously, you've said it is not a time for non-essential travel. What kind of recommendations do you give to people that are looking, a month away from now? Is it going to be safe to be on a plane? Do you recommend it? When should people be starting to think about those holiday plans?
Yeah, I think the messaging right now, has to be don't plan to travel or have visitors from outside of Manitoba coming for the holidays. And even within Manitoba, people shouldn't be planning to have gatherings outside of their household. So like we've always said, if we see a change in our numbers, that messaging could change. But I would encourage people right now to avoid planning non-essential travel. We're still trying to get these numbers down. And I think it's really important to start those plans now to celebrate differently this year, whether that be virtually, just within their own household. Do try to find ways to connect, but it's most definitely not going to be the same holiday season as we normally have, and we have to keep those group sizes down.
From the Brandon Sun, Michelle.
Hello, good afternoon. We are hearing very different stories about the Fairview Personal Care Home in Brandon from the Regional Health Authority and the two unions representing healthcare workers and paramedics. Prairie Mountain Health is basically saying all is well with protocols, but the unions are calling out the lack of PPE, lack of planning, lack of cohorting staff. With staff working in COVID-positive areas than working in areas without COVID, for example. How do you square this information?
Well, I actually hadn't heard all those perspectives. So we do have guidelines that are in place. We are working with the regions, and Prairie Mountain Health has, I believe, good relationships with Fairview and has been supporting them. So we can look at that situation a little bit closer. We do know we have adequate PPE, so if that's not there, that's a solution that's fairly easy to fix. The issue about cohorting can be challenging just depending on the physical layout, but certainly there are there are ways that we can do the best case possible. So I will follow up and talk to the leadership there and see if there's opportunities where we can do better. And for sure, we want to make sure that our staff and the residents are protected.
Thank you. Also, we have a news tip that cases in nursing homes in Dauphin, Gilbert Plains, Grandview, Winnipegosis, etc., are directly linked to an agency nurse that was recently working at the Maples home in Winnipeg and was not pre-tested for COVID before she was sent to these facilities to expedite worker shortage. We're also hearing workers are moving from facility to facility. Can you address this a little bit? How prevalent might this scenario be? And also, how many agency nurses work in Manitoba?
Well, I can answer some of that. I don't have any details on the first scenario that you brought forward. We know we have the one site public health order to limit the amount of sites that a healthcare worker can work at with personal care homes. The order has always and continues to have an exemption for extreme times, and so in many of these sites there are extreme pressures on staffing. So on some sites we've provided an exemption to that, but it doesn't really allow someone to work in multiple sites. It's able to come to one site that is under those strains. So I don't know the details on that, and I don't know how many agency nurses work in Manitoba.
I would agree, though. The one-site model was to exactly prevent that from happening, where one person would go to multiple sites. And so I'm a little bit surprised that happened, but we can definitely look into that. And with regards to the number of agencies, so they're private businesses. We don't really, they have to be registered with the college if they're nurses, but I don't have information on that, as they're not employed by the public health system. So, sorry, I can't answer that.
From CJOB, Amber.
Hi, there has been over 12,000 cases of COVID-19 since October, but only 467 have put in the app that they reported tested positive. Is the app working for what it's intended to do, or why is there just such a small number of people actually using it?
Yeah, so it's difficult to answer. I mean, I think the app is a good tool, and so I encourage all Manitobans to download it and to use it. Because of the nature of the app and the desire to have as much uptake as possible, a lot of it is confidential. So we don't receive a lot of information on just how many Manitobans have downloaded it. If a case has the app and is provided the key to enter in, that's optional. So again, we don't know how many actually enter in the key. And when you're notified as a contact, that's confidential. Public health isn't notified of who receives a notification that they're a contact. Public health doesn't know if those contacts go for testing or not. So it's very difficult to provide an answer on how well it's working. What I can say is it's a very good tool in addition to all the things that we have. So I encourage all Manitobans to get it.
Okay, then for my follow-up question, with you guys not wanting people maybe to travel around the holidays, are there going to be more isolation restrictions going to be put in place because of this?
Well, I mean, nothing's off the table. I mean, right now, if you look at the epidemiology in Manitoba, it's comparable to everywhere in the nation almost. So to have more public health restrictions put in, that may not be something that we're looking for. However, the messaging is clear, and I think the messaging is going to be clear across the nation, is that non-essential travel just shouldn't occur right now. We're right in a second wave of a pandemic. Most centers in Canada right now are hard pressed in the battle against it. So we need Manitobans, we need Canadians to, for the most part, just stay home and not to do any non-essential travel.
From the Winnipeg Sun, Scott.
Hello, good afternoon. Scott Bill with Winnipeg Sun. Question, I guess maybe for Lanette, maybe for either of you. I know Lanette spoke about the homeless shelters. Obviously, that number seems to be rising, or at least the need for shelters for those experiencing homelessness is rising. Is there a dire situation for that segment of the population? Or can you maybe give a bit more insight into what is, I guess, happening with homeless? Those are homeless right now?
Yeah, so we're definitely seeing in Winnipeg and in other parts of the province increasing amount of cases in homeless and those in sort of lower socioeconomic status. And it's definitely challenging when you're talking about transmission dynamics because a lot of the restrictions that we have in place don't do a great job of protecting that segment of our society. So you look at housing issues, which comes with crowding, issues, and even the challenges of self-isolating when a case or contact for people who are the paycheck is quite important to them. So a lot of challenges with it. So there's work being done at the various regional levels to try to address this. We have a lot of work being done and has been done in the alternate isolation accommodations. And so, but definitely we are seeing a transmission in those communities.
Thanks for that. And just going back to the abuse that contact tracers are getting, and specifically the part about where contact tracers are potentially hearing about, employees or employers, still requiring them to come to work and that sort of thing. Is there any follow-up done by Manitoba Health, by, investigators, inspectors, whatever it may be, on that? I assume that, it would probably out the person that does it. But if employers are forcing people to come to work, whether they're sick or they should be self-isolating, is that something that Manitoba Health needs to be looking into more to ensure that isn't happening?
Well, we've had some investigations where that has occurred, where employers were forcing someone to, or the reports were that the employer was mandating that the person come back to work when they were advised to self-isolate as a case, and that was investigated for sure. The issue of contacts is difficult too, and then remember a lot of the people we're seeing now, and depending on their occupation, it's very difficult. They're very nervous to say anything to employers based on their employment situation. So a lot of it now is up to us to message us, is that we're all in this together, and as employers, if you're having people coming back to work who should be self-isolating, you're putting your workforce at risk, and any patrons that might be at that workforce at risk, and thus Manitoba at risk. So we all need to find ways to support people to be at home if people need to self-isolate. It's one of the biggest tools we have to stop the transmission of this virus.
From CBC Radio Canada, Gavin.
Hi there. My question's for Dr. Roussin. I was just wondering if you could provide any more information on how you accidentally reported the death of a 20-something-year-old. What happened there?
Yeah, so it was a data entry error. So it is a case of COVID-19, but the data entry error was that it was that there was a death. So it's definitely a case with the same demographics that is currently self-isolating, but the data entry error led to it being reported as a death.
Thank you. And my next question is for Ms. Siragusa. I'm just wondering, on the help you provided in a personal care home over the weekend, how does what you experienced in terms of what the staff and residents are going through inform sort of how you do this job now?
That's a good question. Well, I didn't really know what to expect when I went in there. There were multiple COVID patients, and I knew they were short-staffed. But when I went in there, it actually was reassuring to me. The staff were very professional. They were collaborative, working as a team, and compassionate. And although everyone on the unit had COVID, they were very well taken care of. They were treated with kindness and respect and dignity. And it really was a privilege for me to be there. But I do know that they were tired. They were working long hours. And so to me, it just really reinforces that we have to not just protect our staff with PPE, but we have to protect them from just burning out and making sure that they have all the support, mind, body, and physical, mind, body, and spirit, I guess, to endure this pandemic, because we're kind of just coming into the midst of it, and we don't know how long it's going to be. So I was really impressed with the entire team, the administrators, the physicians, the nurses, the support team. They were amazing.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, you still have the same hours and availability for swabbing in the Steinbach area. You said we're going to get more testing in that area. When specifically, and can that capacity be expanded?
Yeah, I can't speak to specifics on it, but yeah, that's definitely what's being worked on. We want to increase that testing capacity there. We have a very high test positivity rate, and so I know that that's being worked on. I can't give you a specifics on when that would occur.
All right. And more along the lines of what Scott was asking about with the employers. In addition to employers unwisely asking workers to come back, we're hearing tons of anecdotal reports of employers that are just simply refusing to allow their healthy employees to work from home despite that. Big international employers in some cases. What could you do in the public health order right now with our test positivity rate to essentially require employers to allow workers to work from home, resource permitting?
I think that would be a difficult thing to write in an order. Obviously, there would be a lot of exemptions and a lot of subjectivity in there. If we say, as able to. So I think that for that, we really need to rely on the messaging. We really need to allow employers to, to know they're Manitobans. Their employees are Manitobans. We're all in this together, and we need you to step up. The less people that are going out, especially for non-essential reasons, the better. So if you have people who can get the job done in a reasonable fashion at home, I'm strongly encouraging Manitobans to look at that because we need people to be at home for the most part, out for essential purposes, which often is employment. But if that employment can be achieved appropriately at home, I'd suggest that be done.
From the Canadian Press, Steve.
Dr. Roussin, we have contact tracers getting abused when they call up people. We have people protesting against mask mandates. We have case numbers that have been higher because people were not listening to messaging and maybe awaiting a formal, strict order. If you could go back, do you think that you might have underestimated the willingness of people to abide by guidelines or suggestions rather than firm rules?
Well, I think that's the public health approach to most things, is that we start with messaging and education. We certainly had great uptake in the first wave. We had great uptake in the first part of this second wave in Prairie Mountain Health. So we certainly wanted to message that way. We know we have orders in place, and even with the orders in place right now, as you can hear about a lot of the anecdotes here, is that we still need buy-in from Manitobans. So there's no amount of orders that are going to take care of this in its entirety. We need buy-in. So we need to continue to rely on Manitobans to protect themselves, the people around them, our healthcare workers, and we definitely have to have at some point restrictions in place that are enforceable, and we do. But it can only take us so far if we don't get buy-in.
And the Human Rights Commission says it's receiving between 50 and 100 phone calls per month, people inquiring as to whether the mask mandates violates their human rights. I know you have a law degree as well as your health education. What would you say to people who say wearing a mask is a violation of my human rights?
I would say that the issue at hand here is a pandemic, which is having a great toll on the world and in Manitoba. So we need to take measures to deal with that pandemic. And all of the measures we have in place are directly connected to reducing the risk of the COVID-19 pandemic. And, all of the measures are what we feel is in the least restrictive means to obtain that. So we know we hear of charter rights and human rights, but certainly the drafters of the Charter of Rights realize that we need to be able to sometimes respond to very serious issues, and Section 1 of the Charter of Rights deals with that, and we feel we're well within the scope of that.
From CTV Winnipeg, Michelle.
We're wondering, are there any updates to the outbreaks in hospitals, specifically the Grace Hospital, how many cases there are?
I don't have the Grace Hospital, Michelle, in front of me, but I could do a check and we can get back to you.
Okay. Are there exceptions to hospital visitations?
Yes. The short answer is yes. So we have visitor guidelines that we made provincially to set some kind of standardization, but there is also the appreciation that individual facilities may have to make adaptations because of the physical layout or because of they're in an outbreak situation. So we have guidelines. We really focus on the importance of caregivers, supporting patients, clients, residents. But depending on the situation, the individual situation, there may be some changes. But if anyone's having struggles with the visitor guidelines, I would suggest that they call the patient relations people at the hospital or within the region to see if there can be accommodations made in special circumstances.
Thank you for that. We have time for one or two more questions. Please proceed.
Ms. Siragusa, what's the real ICU number today, including patients who are no longer infectious?
There are, sorry, Bartley, I'll go back to my notes. I think there's 105 patients in critical care right now. So that's all in.
How many beds?
Which ones have COVID?
I think the last report I had was 10.
Hi there. The Manitoba Métis Federation has said repeatedly it has a 96-bed COVID isolation facility that it has open for all Manitobans to use near Treherne. Is the province availing itself of the help the MMF has been offering?
No, I don't. I haven't heard of any updates on that. We can, we'll look further into that to see what's happening with that.
Dr. Roussin, there was always going to be outliers in this, people who didn't believe COVID is real, those who were always going to flout rules no matter what the message was. How is that managed at your level, at the public health level? And is there some, for lack of a better term, just a case of cross fingers and hope for the best when it comes to people who or simply just aren't going to listen?
Well, I mean, that's really where the orders come into play. Right. If we look at, say, vaccinations, we know that there's a certain proportion of our population that will not become vaccinated for whatever reason. In saying that, we have great vaccine uptake in Manitoba, especially for our childhood vaccines. And so we know that there will always be that proportion. What the impact of that really depends on how large that proportion is. And so when we look at right now COVID-19, the length of time it's around, the impact that these restrictions have on so many people, this is why we've had to go to restrictions and enforceable orders, because it's just it's been very difficult for people to comply because it's sometimes immediately out of their immediate self-interest. And so really to address that, this is why we've had to use the Public Health Act, because we just don't have the ability to just hope people will comply. We need compliance.
Mike Albanese from City News here. Question, this is a bit of a peculiar one, but if you live in a condo or an apartment and you're isolating because you're symptomatic, and there's a fire alarm or a flood and it requires you to leave the building, how do you suggest, is there a protocol that people safely get out? Or is this something that fire paramedics need to be aware of? What's the protocol?
Yeah, so I mean, the immediate danger to life and limb will trump, anything like that. My advice would be to ensure you can get to safety, number one. Two is wear a mask. Put a mask on and out, and if anyone try to keep your distance, once if possible. But the most important thing would be the immediate safety with that. And then if you're being cared for by any first responder, make sure you let them know that you've been diagnosed with COVID and advised to self-isolate.
Dr. Roussin, question from a single parent. Dr. Roussin, question from a single parent. With shared custody, if the shared custody is exempt, can that parent, what does that parent do on other days in terms of how many people, what can they see one other person on other days when they don't have the shared custody?
So the messaging is to limit our contact outside of our household to zero whenever possible. If you had a shared custody agreement, that's an exemption to that. If, say, you lived alone, the order would say you would still be able to designate one person as to visit there. If you didn't live alone, then you wouldn't have that other exemption. So, but the messaging is keep your non-household contacts to a minimum. So in a case like that, if at all possible, to keep that just to the child custody issues, that would be ideal.
Thank you, and this concludes today's media briefing.